So I'd like to give our three experts here a chance to say whatever they want to say about spinal healthcare or cervical disc replacements or whatever. So we'll give you each three chance to give some parting words to the public.
I believe that in the next 5 to 10 years, when we call the insurance companies, and if we're asking them for a fusion, they're going to be saying, why aren't you doing the artificial disc? I believe the whole parameter is going to turn. Where now, when we say we want to do an artificial disc, they say, why don't you want to do the fusion? Even though we get paid more to do the fusion, we get paid less, believe it or not, to do an artificial disc, which is much more challenging and skillful to place. But I believe that's going to change because the outcomes, as Dr. Geyer and Armin said, and Tom, you know, the studies, the 10-year studies just show the superior outcomes of neck pain, arm pain, neurologic success, overall success are far superior to fusion, and the adjacent level surgeries are 2.5 times less with artificial disc compared to fusion.
So, Tom, my parting words for our patients out there who may be listening to us today is that as I've gotten older myself, because when I look at myself as a younger surgeon, it seems like I had perfect health myself and things didn't seem as real. But now in my 50s, it would not be uncommon for me to get up in the morning and have stiffness in my back or in my neck. And I realize how important motion it is to my well-being and how important it is for me to do all the things that I love to do, whether it's being at work and taking care of my patients or going out there and mountain biking or golfing or skiing. So it becomes more and more real as a physician and a surgeon who's maturing to understand how important motion and function it is to our well-being. And when we talk about artificial discs, really this is an option that allows us to take care of the patient's symptoms and do so with much better functional outcomes. Again, for the long time, cervical fusion was probably the gold standard and the king of spinal surgery. But I believe now that that particular crown has been displaced, and artificial disc is the current king of the spinal surgery.
It really is great technology, and I think that, you know, if you do have a neck or arm problem and you've been suffering with and you're thinking, well, I don't want to have surgery, you at least owe it to yourself to visit a spine specialist to see what your options are. And I'm not saying you should have surgery, but if it's something that it can improve your quality of life and let you get back to doing the things that you love to do, it is a wonderful, wonderful operation. And I always tell patients, it's really your quality of life that determines whether or not you should do the surgery. And a lot of patients say, well, I'm in my 50s, it's okay, I'm going to slow down, or I'm in my 60s. It doesn't have to be that way. Not that we can bring back the fountain of youth, but at the same time, we can improve your quality of life. And this is a proven technology that in the right hands is safe and long-term results are excellent.
This has been excellent. I'd like to thank Dr. Geyer, Dr. Lehman, Dr. Kachatarian. I think that we have opened a lot of knowledge and shared it from 4 experts who have decades of experience in this to help people understand the benefits of this incredible technology. My advice, my closing words are, if you can keep motion, keep it. And I think that this technology is great. Find experts who are proficient at it. And with that, I think that you can regain your life. And with that, I'd like to thank everybody and look forward to the next part of our spine series on Spine Talks. So thank you all.